This is Dr. Peacock. I want to show you a minimally invasive surgery today. I want to show you the SERI procedure. It's been performed for probably at least 20 years now, so it's a nice little MIS surgery. It's really quick. I'm not a real fast surgeon, but I can do the surgery in usually less than 15 minutes. So it's kind of neat that for that reason, and also it's effective. It's a good procedure. Okay, today we're going to go over the SERI procedure. This procedure is kind of a neat procedure. What I normally do is kind of mark out where my hallux is at, and where my metatarsal head's at. And we're going to make the incision just proximal to where the metatarsal head fans out. With this particular patient, I'm doing it percutaneously, so it'd be more like the Bosch incision and instead of the SERI. But I used a burr in this particular patient through a percutaneous incision, and just made a transverse cut straight through the bone, and this allowed me to transposition the bone over laterally. And then what we do, we take a K-wire once this is transferred over laterally, and we run the K-wire first distally underneath the skin out the end of the toe, and then retrograde the K-wire back. Now this is actually a Steinmann pin, so this is a 20 millimeter pin here. You have to use a fairly large pin. So we retrograde that back into the metatarsal medullary canal, and that we do that with assistance of a hammer. And once that's in place, you can see how that holds the toe over, and also holds your metatarsal alignment as well. So this is how this looks after you got that in there. You can see I've gotten the Steinmann pin into the medullary canal. This can also be done with a saw, is how it's normally described. I do it with a smaller saw, and so I can make a small incision. And this is for people who don't like to use the burr. This works just fine as well. The burr is just a little bit simpler, and this make it cut straight through again, push this over. Same technique with the K-wire or the Steinmann pin. Be sure to use a Steinmann pin, not a K-wire. Steinmann pin, you need at least 2 millimeters of pin. So I'm going to show you a few patients here. Here's patient 1, and you see the pre-op, kind of our normal bunion we see all the time. Painful in shoe gear, painful with certain activities, mostly shoe gear and especially dress shoes. This is post-op. This is at 4 weeks. You can see the small incision we made. This is more of a percutaneous incision here. So I made this incision fairly small here. You can see we get a lot of correction with both our hallux abductus angle and our IM angle. For this particular patient, our IM angle pre-op was 15, and our IM angle, I think I have an immediate post-op here to show you in this video. Immediate post-op, you see it's down to 8. Look how much apposition we get. It's a really tight fit the way we cut this. So this patient went on to have a very good result. Patient 2, this is another patient I decided to do the SERI on. Pretty significant hallux, pretty significant IM angle, and not severe, but enough to need a osteotomy. With this, I did more of a traditional SERI where I made an incision about a ½ inch or so, very small incision. Before and after. Also did osteotomy of the second and third toes. That's how I got them over. So I got a good result there. His pre-op IM angle is 14. This patient has some metatarsal adductus, so IM angle is slightly bigger than this, clinically. And that's pushed over. The foot is really straight. You can see it looks like I've overcorrected the hallux, but I did that on the table. It looks good clinically. The patient's very happy. So I threw in the Aiken. This is a patient we recently did, fairly significant IM angle, and I decided to do the SERI because I didn't think the patient was a good candidate for base wedge. Got a good result here. This is actually 4 weeks post-op, and we did arthroplasty on the second toe because of some problems with the joint there. Pretty good result with that too. So that's what we're seeing there is about 4 weeks post-op, and we just pulled the pin. So the SERI is a good procedure. You get some good results with this, and I like it. It's very quick. Don't have a lot of problems post-operative with this. and patients don't have a lot of pain with this surgery as well. So I don't know, it's just as good as some of the other MIS surgeries. Most guys who have been doing this SERI have found favorable results with it.